This is LifeShare Blood Center, and today we are welcoming Senator Bill Cassidy. Today, Senator Cassidy is coming in to donate plasma. LifeShare is really in need of convalescent plasma, which is plasma from COVID-19 patients who are now recovered. And so Senator Cassidy is here today to show just how easy the process is for people to donate plasma. So he came in and is donating a couple of units of plasma. It's a very easy, very quick process, and it's something that anybody can do, but particularly we need those recovered COVID-19 patients to come in and donate their plasma. If you've had COVID-19, your body has been able to fight off the virus. It's developed antibodies, and that's what's helped you be able to recover. For folks who are in the hospital on ventilators, their immune system isn't responding as well. So we're hoping that we can take the plasma from our recovered donors with those special antibodies and put it into someone who is still suffering and who is gravely ill. And we're hoping that will give their immune system kind of a jump start to help them fight off the virus.
We're donating plasma. Blood banks in general need more blood supply. Plasma is being used in particular for taking antibodies from those who have been exposed to the COVID-19, taking those antibodies out of that plasma and giving it to really sick patients. And it appears that taking those antibodies from somebody who's recovered and giving it to somebody who's in terrible shape is going to help that person who's in terrible shape. So it's how we can become a healthcare provider by providing plasma. If you've survived COVID-19, your plasma can save somebody's life. By the way, it's not just though the people who have survived COVID-19. Your plasma can save somebody's life anyway, independently of having been infected with COVID-19. So I try and be a regular blood donor anyway, and so it's just nice to be able to do it in this context. But by donating blood, you can help save somebody's life, and particularly in the case of the COVID-19, if you've recovered, then you're particularly able to benefit others. It is not a big deal. I can tell you this woman has probably drawn blood on 1,000 people, and she's incredibly skilled. I didn't feel it going in, and I'm just sitting here. At the end of it, they're going to give me a cold drink, and so they're going to make it nice for me. I'm in a very comfortable chair, and so it is just not a big deal. One, you're saving your life and maybe saving somebody else's life if you stay at home. We were having an epidemic that looked like that was going to wash over our state, and because people have been so good about staying at home, wearing masks when they go out, we've seen that epidemic recede. People are saving lives by listening to the president and by listening to the governor. And it may be your own life. Now we need to get through this so we can let people go back to work, but it has to first start by getting the number of cases down. And we're actively doing that, and I just want to thank the people of Louisiana. We have to have a plan going forward. I was on a call with the president just before I came here, have been in regular touch with the governor. Those plans are being developed, and I think we'll see them come out soon, but it starts with getting that rate down, and that's what we're doing now. There's like 1/3 of the counties in the United States that have not had a case. So if you're a farmer who needs to put up a barn, maybe it's a different story than if you're in a city that's been hard hit. So there will be, and we're a big country, so in a big country you're going to have that sort of then you're going to have that sort of kind of variability. On the other hand, listen to your governor, listen to your local health officials, and they will give you instruction as to when they think it needs to reopen. They're going to be looking at the statistics that will allow people to keep their safety engaged. But it also requires, by the way, when we do open up, for people to be careful. I couldn't get a nice mask, but hopefully at one point everybody will have a nice mask that will be able to prevent them from infecting other people or getting infected. If you go to your local grocery store, you're going to need that mask. So we do have to have a new kind of sense of how we live our lives until we get a vaccine that can help people. So my wife has repainted 3 rooms in my house. I spoke to somebody, of course I'm working all day, I'm on my phone, just trying to, talk to different people, get things going. She's painting the house. Somebody else I talked to has redone their garden. I walk around the lakes at LSU, and there's all kinds of people getting exercise, some of them wearing a mask. And so it is possible to do something positive with your life. Get in shape, clean up your house, all those things you'd like to have time to do, get them done. You can also call people. There's a lot of people who are by themselves. They are shut in. If you give them a call, you'll make their day. If you have a little bit of extra money, maybe go buy grocery shopping and picking up some groceries for somebody who doesn't have a car. We've done that to a couple of our neighbors. They are incredibly thankful. So you don't have to scratch very much to find somebody who needs some help right now. We get through this if we get through it together. CDC currently recommends that if you go out, you wear a mask. All of you are staying about 6 feet away from me, but she cannot, obviously. But it is important, if you can, both to prevent infecting others and getting infected. This is not the best mask. This is just what we had, and this is what my daughters use when they go out to the grocery store. But if you have a mask, you should be wearing it, particularly people who are at high risk. If you are over 50 or 60, you got diabetes, high blood pressure, you're overweight, you are at high risk for complications. And so you particularly should wear a mask if you go out. Other people who are on cancer, chemotherapy, maybe who have HIV, AIDS, steroid treatment, something like that, you are at particular risk, and you really do need to wear that mask to protect yourself and to protect other people.
Senator Cassidy has not had COVID-19, but he's here to show how easy the process is and to bring attention to the fact that blood centers across the country, especially here at LifeShare, we need that convalescent plasma in order to provide it to the hospitals so they can continue their life-saving work to help fight COVID-19. LifeShare is the blood center all across the state of Louisiana, all the way from Shreveport and Monroe through Alexandria and down into Lake Charles and Baton Rouge. And we are asking people not only to come to donate plasma, but also whole blood, double red cells, platelets. Our hospitals are in need of all of these products right now, and we want to be able to give them the tools they need. All of the information about our convalescent plasma program is at lifeshare.org. You can also go to our website to find out all the list of blood drive locations, our donor centers, and where our mobile buses are going to be. You can just type in your zip code and you'll know when the next drive is in your area. It's really easy to schedule an appointment and to come donate blood. We don't have a lot of opportunities right now to get out of the house. This is an opportunity that you have to get out and really make a difference in the community. Understandably, people really don't want to get out and about right now, but LifeShare is taking extra precautions to make sure that our donor centers are as clean as possible. First of all, we only want healthy people to come and donate blood, whether you're sick with just a little cold or if you have COVID-19. We don't want you to come donate if you're not feeling well. Additionally, we're taking temperatures on anyone who walks in the door. We've got extra cleaning procedures we're doing. We're limiting the number of people in our donor centers and on our donor buses. So we're doing a lot of things to make the environment as safe as possible for people who are wanting to come in to donate.